Our team at the Liverpool Heart and Chest Hospital recognise that your stay in our critical care area can be a difficult and stressful experience for both patients and their families. The aim of this short video is to inform you about what to expect after your operation and during your stay in our critical care area. You are welcome in our critical care unit between 8 AM and 9 AM and 12 PM to 8 PM. However, if this is not suitable, we may be flexible to suit your needs. Visitor rooms and our critical care garden are available for you to use, and we try our best to get you into the unit to see your relative as soon as possible. Liverpool Heart and Chest Hospital Critical Care Unit is comprised of 3 areas: POCU 1, POCU 2 and ITU. On arrival to the unit, please press the intercom and wait until a member of staff can attend to you. To help us combat cross-infection, please remember to use the alcohol gel provided. On arrival, you will have a breathing tube in your mouth which is attached to a breathing machine or ventilator. Do not worry, this will be removed when your anaesthetic has worn off and you are fully awake and able to breathe for yourself. You will also be attached to a monitor. This enables us to assess your heart rate, blood pressure and oxygen levels. You will have 2 to 3 drains in your chest to help remove any excess air and fluid from around your heart and lungs following your surgery. The drains are attached to a collection chamber and will make a loud bubbling sound. Once the drainage has stopped, your drains will be ready to be removed. It is normal to have a urinary catheter in place so that we can monitor your kidney function following your surgery. Intravenous devices will be inserted in your arm, neck and possibly your groin. This allows us to painlessly take blood samples and to give you fluids and important medications. Your intravenous devices, tubes and your catheter are usually removed when you are ready to be discharged back to the ward. Following your surgery, you may experience some discomfort or pain. This is normal and we will ensure that you are provided with effective pain relief. Critical care can be noisy with frequent alarms which may make you a little anxious, but try to remember you are never left alone and are continually monitored throughout your stay by our excellent, compassionate and safe critical care team.
I came in to have a triple bypass operation in January, end of January. I didn't have any symptoms at all in January. I had a holiday and felt a few chest pains in my second week. Just took it that it was just the heat of the holiday, and I went to Arrow Park Hospital, which is my local hospital, just to get the pain checked out. I was told I was having a heart attack and I was transferred on that Monday afternoon. I had an angiogram and they confirmed that I had a heart attack, and the following Thursday I had a triple bypass operation. The minute I walked into brought into the building by the ambulance, everything was just taken care of. There wasn't any worries at all. Everybody was just so kind, and there was no panic with the staff. They were put at ease straight away. Obviously, but yeah, the staff were very good. Any time of day or night, whenever I needed anything, they were there for me. You'd see me in the video. The second part of the video where I'm sitting up in bed, that was actually the day after my operation. On that day, I was actually taken out of bed and allowed to walk around the ward. I was let out of the hospital 5 days later, and I just went home to recover. About 2 months later, I had to go to my local hospital for rehabilitation, which was just very light gym work at your pace. There was no pressure on to, do anything too strenuous. That was closely monitored and that was done for 6 weeks. And then about 4 weeks after that, I went back to work, full time. What does help you as well is your own state of mind, because I just didn't want to be ill. I didn't want to be a sick man. I've never been like that, and I just had it in my mind that, you know, I've been told that I've been fixed, the plumbing's been done, and you can have a better than normal life. So with that in mind, I thought, well, I'm just going to do what I want to do. You know, obviously with time to build up to a good normal life. But all the things I've done since I've been out of hospital, I've not had any problems with at all doing anything.